Somewhere along the way, PCOS became synonymous with infertility, and that's not accurate because PCOS is not a root cause of infertility. Hi, I'm Dr. Cindy. My husband, Dr. Cody, and I are the doctors behind Fertility for Two, a program that helps couples get pregnant naturally. We are both naturopathic doctors and acupuncturists. Our goal is to talk openly and honestly about fertility and the process of trying to conceive. So before we talk about what PCOS means for pregnancy, we need to talk about what PCOS actually is. It stands for Polycystic Ovary Syndrome, and there's the first problem. The name is misleading. Those cysts aren't actually cysts. They're small follicles, which are immature eggs that haven't completed development. So PCOS is diagnosed when you meet two of the following three criteria. 1, irregular or absent ovulation. 2, elevated androgens. And 3, polycystic appearing ovaries on ultrasound. So did you catch that? What's not in the definition is infertility. So while PCOS is a pattern of hormone signaling issue, infertility is defined as the inability to conceive after 12 months of trying or 6 months if the woman is over 35 years old. It's important to distinguish that PCOS does not mean that you can't get pregnant. It just means that you're not ovulating consistently. If ovulation is inconsistent, that tells us something about the woman's system. It doesn't mean that the system is broken beyond repair. It's just that it's not well regulated. From a Western medicine standpoint, we call this hormone imbalance or insulin resistance. From a Chinese medicine perspective, we would describe PCOS as a pattern of imbalances in the reproductive system, giving rise to things like sluggish metabolism, fluid accumulation, cyst formation, weight gain, and irregular cycles. In Chinese medicine, ovulation depends on 3 major systems working in sync. So we have the kidneys, which represents reproductive reserve or hormone vitality. Then we have the spleen, which governs metabolic function and fluid balance. And then lastly, we have the liver, which ensures smooth hormonal signaling and blood flow. So when insulin is unstable, stress is high, or inflammation builds, we often see what Chinese medicine would call kidney deficiency, spleen damage, or liver qi stagnation. These are simply different lenses used to look at the same physiology. And the beauty of looking at PCOS through both lenses is that it helps us identify patterns, and patterns can be changed. So let's talk about what's actually happening in most cases. In many women with PCOS, the root driver is insulin resistance. Higher insulin levels stimulate the ovaries to produce more androgens. Those higher androgens stall egg development. That means ovulation doesn't happen regularly, so you skip cycles. Now that does not equal infertility. All that means is you have inconsistent ovulation, and you cannot predictably get pregnant if you're not consistently ovulating. So when we restore ovulation, fertility returns. To get into even more detail, restoring ovulation is still only part of the equation. We also need to improve the quality of that egg. An egg takes about 90 days to mature before it's ovulated. During that time, it's highly sensitive to things like blood sugar instability, mitochondrial function, inflammation levels, nutrient status, and stress hormones. In the Fertility for Two program, we don't just aim for ovulation. We also ask, was that egg supported by a healthy environment? Because getting pregnant and staying pregnant requires a resilient egg. So now let's zoom out. Your body is always asking one question. Is it a safe environment to reproduce in? So if some of the symptoms I mentioned earlier exist, like your blood sugar is unstable, inflammation is elevated, stress is high, sleep is poor, or your circadian rhythm is off, your body may pause on ovulation, not because you're infertile, but because it's redirecting resources elsewhere first. I've worked with many women who were told that they probably need IVF to conceive a child, but once we improved their metabolic health, their ovulation became consistent and their progesterone levels rose appropriately in the luteal phase. Then they conceived naturally. Not because we forced ovulation, but because we restored function. Now, I'm not saying every case of PCOS is simple because there are different types of PCOS. Some women have insulin-driven PCOS, some are stress-driven, some are inflammatory, some have thyroid involvement, and in many cases, there's also male factor issues layered on top. So that's why stating that PCOS is the cause of infertility without digging any deeper is just lazy. We still have to find the root cause of PCOS. So ultimately, this is what I want you to hold on to. PCOS is a message, not a verdict. In the Fertility for Two program, we never treat the label. We treat the pattern, and patterns change when the environment changes. So when you correct the environment with personalized protocols involving things like nutrition, sleep, light exposure, movement, and stress regulation, ovulation often returns, and that's when pregnancy becomes possible naturally. So if you have PCOS and you've been trying to conceive, please don't assume that you're infertile. Instead, ask the following questions. Am I ovulating? Is progesterone strong enough in the luteal phase? Is my insulin stable? And has male factor been evaluated? Because at the end of the day, PCOS is not the end of your story. It's your chance to ask better questions. If this video helped you understand your body in a new way, subscribe to our channel where we talk about fertility and health. If you'd like to work with us, visit the link in our profile. From our family to yours, have a fertile day.